I had a sort of keyhole surgery, so one of the few in the ward that did that. I think that aided recovery quite quickly. So I was in hospital, I think about 10 days, only partly, I think, half the time to make sure that the bowel was working properly after surgery. And I think I was sort of very keen to get back home. So I was sort of, we were doing the walking and out and about and just sort of talking to people and talking to other patients and things. I think I couldn't switch off my professional head, so I was still engaged in that way. And I think one of the things I did push the hospital doctors just to say, well, if you try that medication, yes, the bowel will move, you know, lactulose is wonderful, give me some so I can go home. And of course, as soon as I got home, I wish I was back in hospital because, you know, the care in the hospital, it was a lot warmer, the hospital was flatter. I noticed that sort of being out in the world where everything isn't totally flat and you're still quite raw from surgery, that was quite painful and took a while. So I think I had a bit of a relapse at home. But the district nurses were very, very good. I was living with my parents at the time because I was ill. It was, you know, best place to be there. And the district nurses were the ones who sort of treated my mother, so I did know them quite well. So, and that was quite useful to have somebody come into your home and just having a quick look at you know, your stitching. The stoma nurses, the first sort of, I can't remember whether it was 3 or 6 appointments. I think it's 3. They come to your house and help you through all of that as well. And then you can have additional sort of appointments at their clinics.